Hi, welcome back to Nurse Ed Scholar. You know, um, Today we're going to talk about perfusion simplified. So you're going to learn um, about perfusion in your first semester. Okay. If you've passed your first semester, you're going to learn about hemodynamics before or at your last semester or somewhere in between. You're going to have other levels that's going to touch on perfusion. And, it's really going to feel like two different things. It starts off as perfusion, but it ends up as hemodynamics, but realize that they're not different. Hemodynamics is just perfusion with numbers. So today I'm going to reconnect the foundation so it all makes sense. And that's why I'm putting this video in here. Now, what actually is perfusion? Perfusion is when blood delivers oxygen and nutrients to the tissues, and that's it. If perfusion is adequate, the brain is alert, the kidneys make urine, the skin is warm, lactic acid stays low. However, if perfusion fails, your patient is going to have confusion, hypotension, oliguria, so they're going to have a low urine output, cool extremities, and shock. I want you to realize that every major NCLEX topic connects to perfusion. And this is what I mean. Think about it. Cardiac questions relates to perfusion. Respiratory questions relates to oxygen delivery. Sepsis is perfusion collapse. Fluid questions is the volume affecting perfusion. ABGs look at oxygen affecting perfusion. And then dysrhythmias is where the cardiac output affects perfusion. I mean, even in pharmacology, you're going to learn about vasopressors that increase perfusion, diuretics that reduce congestion to improve perfusion, inotropes, which are going to increase perfusion, increase blood pressure and, cardiac output, right? So really, when you're looking at the exam, it is constantly asking you, is perfusion safe? Okay. So what drives this? Perfusion depends on basically three things: volume, the pump, so your cardiac output, and your vessel tone. And when you look at when you look at volume, pump, and vessel tone, it's the same framework that we talked about in hemodynamics. Volume, it's if it's too little, that'll be shock. If it's too much volume, you have congestion. So congestion with congestive heart failure. The pump, if the pump is weak, your cardiac output is going to be affected. You're going to have low cardiac output. If the vessel tone, if it's too dilated, vasodilation, think septic shock. If it's too constricted, think high afterload. Think about that heart having to pump against the resistance of um of those constricted arteries. You know, I hope you can now see how perfusion and hemodynamics they really connect. So how are you gonna, realize that your patient has poor perfusion, right? And if you notice with every video, it's the same thing. You know, And especially, try to remember it because when you answer NCLEX questions, you need to look for these clues. Does your patient have low blood pressure? Is there a mental status change? Is there a decreased urine output? Is there cool and clammy skin? Does the patient have a delayed capillary refill? Is there an elevated lactate? Because all of these are signs of poor perfusion, right? And think about it. The exam is rarely going to ask you, is perfusion inadequate. It's not going to do that. It's going to show you the signs in the stem of the question. Okay. So let's look at, a few scenarios. Okay. You have a post-op patient, blood pressure 88 over 50. Their heart rate is 120 and they're restless, right? So you have low cardiac output, but you have high heart rate. So that heart is pumping, trying to move that blood throughout the body to perfuse those organs, right? So you have a perfusion problem. So you're going to think, let me assess the volume status. Let me think that when the provider comes, there's a possibility for an order of fluids or to increase the amount of fluids the patient's going to get. Let's move on to two. Now, the second patient, you have heart failure. So heart failure and you see crackles. You should think, okay, crackles, JVD, jugular venous distension. The patient is fluid overload. And then you look at that oxygen saturation. It is 88, right? So the oxygenation is poor. The patient heart, they have low cardiac output. It's telling you in the stem, it's a heart failure patient. And then you have a congestion problem because now you have too much fluid. So there's the crackles, there's the JVD. Just with these simple statements, you can have an idea of what kind of patient that you're dealing with. So you're going to think, okay, the SpO2 is 88. Patient needs oxygen. Crackles, JVD. Patient possibly needs some diuretics. And then there's a heart failure problem. They're going to need inotropes like dopamine. And dopamine increases blood pressure and cardiac output. Okay, so just by this simple scenario, you should be able to pull different things about, okay, what's going on with my patient and what can I anticipate? Anticipate, right? Okay, number three, you have a sepsis patient. Right then and there, sepsis patient, vasodilation. Patient has warm skin, a low blood pressure, 82 over 50. They have tachycardia, the heart rate is 120. So they have a vessel tone problem. They have vasodilation because of the sepsis. So you're going to think, I need to give this patient some fluids and maybe some vasopressors to try to get um cause those vessels to constrict some to raise that blood pressure. And this is what you're looking for. This is what you're looking for. Every stem of the question is going to give you the clues that you need so you'll be able to answer the question. And we talked about this perfusion decision framework before. You know, when you see a question on the NCLEX, think to yourself, is this a perfusion question? So, okay, you see a low blood pressure, you see crackles or signs of poor perfusion. You're thinking, okay, is the perfusion adequate? All right. Then you're like, man, is, what's causing the perfusion to be inadequate? Is it a volume problem? Is there too little volume or is it too much? Is it the pump? Is the pump weak? Is the heart weak? Heart failure. Is that what's going on? And then the tone of the vessel. Can you tell, is the vessel dilated? You know, is it constricted? Is it showing you any kind of reason of, we talked about sepsis. Sepsis would tell you vasodilation. Okay. And then when you gather those questions, you're like, okay, so what intervention would restore oxygen? And so if, of course, if the stem of the question, if it gives you an O2 saturation, that'll also give you a clue of what are you going to do to help restore oxygen. And, you know, really when you think about it, that's the deeper pattern behind nearly every perfusion question. Okay. And honestly, I mean, that's it. I hope this little added video kind of connected. Okay, well, how is the hemodynamics similar to perfusion? Well, it's practically the same thing. And so if that made sense to you, please type in the comments. Perfusion is the foundation. And next, I'm going to do full cardiac integration, trying to put all of the cardiac priorities together. I don't have my face on today. I'll have my face on with other videos. But, if you like it, please like the video. Please subscribe to Nurse Ed Scholar because I always say this at the end of the videos. I really want you to study smarter so you can test like a pro. And until next time, happy studying from Nurse Ed Scholar.